all so much for having me. And I want to start by saying that it's not lost on me that we are coming together in one of the most stressful and challenging weeks of the year, um, which has translated to a lot of heavy work for many of us, and particularly for those of us who are working in community. And so I want to take this time to just start by acknowledging the ways that many of us are serving within our communities of queer, trans, Black, Brown, and Indigenous folks. And we've been carrying the impact and load of the socio-political climate for centuries, right? Not just this week. It's in our DNA, it's in our personalities, it's in our names. And I just want you to know that I see you, I see myself. And I want to invite us into some compassion around all that we're holding in this moment. Collectively, even. Over the past year, I think it is safe to assume that we have faced countless injuries. We've ushered in new life, potentially. We've started new projects and businesses, and our nibblings, nieces and nephews, have reached milestones. We've helped loved ones transition. We have grieved, we have worried, we have prayed, we have danced, and we've been riding this wave of human experience, I believe, in the best ways that we know how. And I think we're doing our best. I imagine as psychologists and people interested in psychology that we can understand that we're doing our best. And in many ways, I think it's important, and we'll talk quite a bit about our socialization, but I wanted to offer up just at the outset that many of us and some of us know and have been socialized to love, and others have been socialized to maybe compete. Some of us have been socialized to heal. Sometimes we're socialized to harm. We're socialized to create, hopefully, but in many ways we're socialized to destroy. Socialized to empower, but then also to dominate. And so if it were up to me, we would probably all just have a collective cry, and that would be the talk, that would be the keynote. I think that would be what I would need and what probably would serve me. But instead, I have some intention on sharing some context for our socio-political climate. And then I'm also going to share some frameworks that I think will be helpful in our practices, in our research, in our teaching. And I think that these frameworks will hopefully sustain us for the psychology of 2024 and beyond. This will be interactive, so we're gonna depart in some ways from the traditional notion of a keynote, and so there will be opportunities to be with one another and to dream up ways that we can reshape how we think about care. Okay, so we're gonna dive in a little bit, and I would say that our socio-political climate is trying us, as my people say. Our frames for our lifestyles, values, and the ways our ways of being are bending. They're shifting, and in some ways maybe cracking even. Technology has made it possible for us to learn at the speed of a 30-second sound bite or video. That's your TikTok reference. And I know there's going to be a talk on AI later in the conference, but there are social movements that are tugging on our hearts for change and accountability. And public health crises have absolutely restructured how we work and how we live. And I don't think that I've had too many conversations with other mental health professionals in professional spaces about the impact of us serving people amidst global environmental and social crises. We've just kept going, or I have anyway. In my experience, my spirit and my body knows that this is not sustainable. So what are we navigating, and what does it mean to be providing care? So in our current system, pardon me, this is definitely the not the latest of this. So, but in our current system, we are socialized toward things like gender, race, size, religion, and it's oftentimes at the hands and the benefit of capitalism. Or another way to think about that or define it is the accumulation of wealth via competition of market prices and wages. And capitalism is, in essence, the rule of order. Capitalism is not opposed to exploitation. And in fact, it is kind of running on it and functioning on it. And this movement toward capitalism has led to a lot of collective stress and trauma. So the socialization then means that we place value, and value is assigned to in such a way as to determine that some of us are inferior and thereby appropriately subjugating other identities. We're socialized to chase supremacy or not being the other. We're socialized to make sure our kids are not the other. And there is a right way to perform these things, like gender, for example. And so it is, I'm gonna hop around here, no surprise to me that then we are a little cooked, we're a little burnout. In decolonizing therapy, Dr. Jen Malin defines burnout as an expression of late-stage capitalism or capitalism fatigue. And what I want to draw to your attention here in looking at the Oxford definition are the words reduction, failure, overheating, collapse, overwork, and stress. One, it doesn't sound pleasant. But it's also interesting to me that most of these definitions and how Oxford defines burnout is less about biology and people and more about physics, right? It's almost like another way we can think about it is that maybe burnout is the result of working and behaving as if we are machines. And I believe as psychologists, whether we're practitioners, researchers, instructors, trainers, or leaders, we find ourselves steeped in this climate and trying to find a better way for ourselves and for our people. And so I think pardon me, I'm gonna pause and get the presentation and try to upload the presentation because so I'm so sorry. Pardon me, just a second. Can, is Dana still in the room? I was gonna try to wing it, but it's getting hard. I think I'm working it out. But I just didn't know if I might need you to get us back on. Please. It's just too far away from. I'm so sorry. No, I thought it was something, so that's not a point. I'm in my. You're in yours, so, okay. Oh, no. There's your code. It's okay. And then, is it gonna just come up when I click this? It should. Ah, there we go. Again, so sorry. No, it's okay. I'm just charging my phone talking now. Okay, I'm all set. One thing I intended to be able to offer you all is the updated version of this. And so if you click on that QR code, you'll have access to it, but they'll also upload the document. So I'm just going to scroll back through. And we'll make sure it's on the portal you all have as well. So I'll go do that right now. Okay. Okay, here we go. Okay. So turns out humaning is hard. Case in point, right? And it turns out we're not machines. We're not perfect. And because we're designed for survival, we're all primed to do just about anything to feel safe. And we will not cancel us. Adrienne Maree Brown provides some wisdom in how we can hold tight to one another and stay in this thing. But we are humaning is full of conflict, of contradiction. We make mistakes, there is discomfort, and oftentimes we are not normalizing these experiences with one another. But all of this stuff is hard. And we could spend tons of time considering the ways that it is, but what I'd like to offer up for us is some reframe for how we're thinking about these things. What I'd like to offer up is that an understanding is that maybe our behaviors are less about who we are, and we could better understand them as how we are adapting for safety, belonging, and dignity. We need to be able to be in our bodies in relaxed and open ways. I'm going to be my best self as a provider, as a student, as an instructor and family member when I'm present. And this is a sidebar, but for some of us, in order to be and experience safety, belonging, and dignity, We've had to leave spaces and positions that don't allow for it. And not all of us will be able to do that. It's a privilege to be able to do that. But I just thought I'd throw that out there, particularly for those of us who maybe are going to be considering graduate programs, or maybe you're going to think about a new position or a promotion. This might be some good criteria, right? To what extent do I experience and will I be able to experience safety, a sense of belonging, and dignity. And I just want to point out that some of us are systemically granted dignity, right? We're able to, the systems and the structures that we operate in are created for some of us, and for others of us, the systems are not created that way, and we have sort of this uphill battle. So what I'd like to offer up is that we are then shaped by all of these things. That socio-political climate that I talked about, capitalism, burnout, and trying to figure out the toughness of humaning. And so there are different levels at which we are being shaped. And we're going to talk a little bit more today about the individual level, the family and intimate relationships level, institutions, social norms, and spirit and landscape. And I believe that as psychologists and people who are interested in psychology, those will be important. At the individual level, I want to invite you to think about the ways that our socio-political climate is impacting what you believe your nature is, and what you believe the nature is for and what you believe about your family and your friends. At the family and intimate network level, how have your experiences of family shaped you? What did you learn about safety, belonging, and dignity? About resources, about equity? In our communities, it's important to be thinking about just who your communities are, but our communities have certainly shaped us, and others have been shaped by our communities. When we think of considering institutions like education, healthcare, media, religious institutions, they too are shaping us. They've shaped our ideas, our actions, how we relate to one another. And it's oftentimes these institutions who have harmed us. We harmed us and those who we care about. Our social norms, which are impacted by historical forces, through those, we've learned who naturally deserves more safety, belonging, dignity, and resources. And we've learned who different groups are assumed to be. And then lastly, for spirit and landscape, I want you to invite you to think about spirit and landscape as how we're connected to vastness and the unknown. So I'm not going to tell a room full of people interested in psychology and psychologists what it means to care, but I believe that's what's most people are longing for. And certainly as a practitioner, that's what my clients come to expect. And I always tell trainees, when in doubt, when you don't know what to do in the room, when you're working with someone, just care, just act like you care. And I want the rest of the presentation and for what we think about, I want to invite us into a conversation and some dreaming into sustainability. Maybe I'm the only person in the room who has had a supervisor think or encourage you to think about like, well, maybe you might want to slow down. I'm worried about burnout. And, I somehow thought that I was immune to that, y'all. And I believe that doing the job of 3 or 4 people was just the work. This is what the work looks like. And here I am 8 years later, still trying to figure out how to sustain myself. And so I want us to look at now some frameworks that we can potentially operate from and who for how we look at sustainability. So you might remember the image from before. And when we think about like the politics of care, and I want to invite us to be thinking about the future of care. And remember, psychology, or I want you to think about psychology at that institutional level. That's our frame. And our psychology, of course, includes, our service, what we do for training, for prevention, research. And I oftentimes will tell folks that on this horizontal level, this is our lane, particularly those of us who are practitioners. And there's opportunity for us to tap into some of what I believe will make a difference and certainly sustain not just ourselves, but also sustain us as a field. And so again, coming back to the different levels that we can look at how we are shaped. So before thinking about how we are shaped, and then now thinking about how we can change. And again, going to look at the individual level, looking at our families and intimate networks, institutions, social norms, and then spirit. So at the individual site, I want to introduce you to a model. It is called BLFM, and it's rooted in a Black feminist framework. And it is a platform and a model that we look at the different chambers of where a person might be able to do some work. And so heart chamber, body, for example, workspaces and relationships. And for example, heart, right? You can think about the ways that you can seek spaces where you can be your most authentic self, where we can notice our emotions and how they shift across spaces, where we can practice vulnerability. We can share our emotional and social support needs and desires with others. And these are just examples. And what I appreciate about BLFM and the way that I think that it is a model for the future is that it is encouraging practitioners to be helping people to be thinking about each of these chambers as our relationships to ourselves, thinking about our connection with other people, and then also community. This is an image that is from the BLFM healing, and it's hopefully you'll be able to download it, but the frameworks, the Black feminist frameworks, are around the outside. And what you can do when you download is you can download a packet that will actually walk you through creating a healing potion. When we think about social norms, I really want to invite us to think about disability justice. And I think especially for us as mental health professionals and as psychologists, really thinking about the ways that I think more and more as our environments are impacted by the socio-political climate, we're more and more disabled from the environments. And we're, I think, actually learning how to live while and work while in pain and while sick. And one of the things that I appreciate about disability justice is that it helps us and has a framework that our beds are worlds, that our cars are worlds, our houses are worlds, and our bodies don't need to be normal, quote, normal, to be valuable. And that we can build in pause and space for grief to make our movements more flexible and long lasting. Many of you might be familiar with the 10 principles of disability justice from Sins Invalid. I'm not going to go through all of them, but I wanted to highlight and invite us to think about having a more anti-capitalist politic and considering the ways that we think about, that we don't believe human worth is dependent on what and how much we can produce. Sustainability, that we pace ourselves individually and collectively to be sustained for the long term. And that we value the teachings of our lives and our bodies. Asking ourselves, who dictates our pace? And oftentimes we're socialized into the rat race and fear not being valued if we keep up, but we need to interrupt that. And also collective access. And by that, I mean using the diversity of who we are to bring flexibility and creative nuance to how we engage with one another. At the institutional level, which again is just reframing how we think about psychology, I think is really important. And within Division 17 of Counseling Psychology, Society for Counseling Psychology, we've been thinking and talking quite a bit about the psychology of liberation. And some of the principles of liberation psychology is looking more for our interventions to be rooted in the affirmation of folks whose identities are marginalized, and looking at those values and going beyond academic knowledge, really attending to the soul and culture of self, community-based intervention, consciousness development, and interrupting individualistic notions of care. So not just about working with the one person that we have in the room, but really expanding that. Another framework is decolonizing therapy, the work of Dr. Jen Mullen, which I referenced before. And I really want to, in this frame, invite you to think about who taught us, and is that who we want to be learning from? What have folks taught us? And is it what we want to be learning? Who approved what we're being taught and what we're learning? And is it really what we want to be modeling our practice from? And then lastly, why was it approved? Why was what we're learning approved? And are those really our values? So what I'd like to do now is invite us into some discussion. I noticed that not everyone is sitting close by someone, so you might have to move around the room in order to do this, but we are going to take opportunity now to kind of reflect together. Okay. So I knew there's a lot of information that's been coming across the screen, but these were the 4 frameworks that I briefly talked about. And so what I want to invite you to do and to think about to help us with this next portion is psychology of liberation. In other words, what would it look like for you to interrupt notions of individualistic notions of care? For the BLFM healing model, considering what areas of your life you have capacity to heal, maybe even how you can strengthen your connections, and where can you be of service to your community? For decolonizing therapy, how might you make space for unlearning, for grieving, for raging? And what wisdom can you use from your own people? And then lastly, disability justice. Where could you use reminders that your bodies and your brains don't need to be normal to be valuable? Okay. So what we are going to do now is talk a little bit about us. And I want to give you an opportunity to be in the room and get to know who's in the room. And so you're going to pair up with one other person, and you are going to first introduce yourselves, name, and however you'd like to be referred to, pronouns if you use them. And then select one of these to discuss and to talk about. Who do you belong to? Who are your people? How have your people shaped how you think about care? How have your people shaped how you practice your interest in psychology? And how has being a person interested in psychology shaped how you people or how you connect with other people? So you're going to select whichever one kind of speaks to you. And then you're going to talk with one other person. You're going to pair up and share. If you haven't already in your pairs or I see that some of you all are with three. If you haven't swapped already to hear from the other person, do that now. Okay, we're going to take about 1 more minute. So go ahead and finish up your last thoughts. Testing. Okay, I hear a little bit of a quieting. So part of the reason that I wanted to invite us into some dialogue about with one another is that I think that that's a part of what we need to be doing, and that we can learn and take a lot from ourselves, and that we really don't have to go outside of ourselves in order to think about change and think about revolution and things being different in our lives. I would have loved to go around and hear from some folks, but just to model, I'll share a little bit from this in terms of who I am. So I come from a big family. This is who I belong to. I mean, big like birthdays are 30 people deep. That's what I've known. My mom is one of 8 kids, and so we just, we're it's big, it's deep. We laugh to keep from crying, as my grandmother used to say. We have gaps in our teeth. And just about every person who's in my life, every friend, has met someone from my family. And I think a part of that is because my family is me. To know me is to know my family. My maternal side owned a soul food restaurant here in Oklahoma City. Um, uh, Probably it's been closed maybe 15 years or so now. But we were part of the community, and we feed people, we're generous, we still do that. So it's really good food around around my family. When I think about care specifically, I think about my grandmother, Lavelma June. And she and her father, my great grandfather, owned the soul food restaurant. And I witnessed her, serving and feeding people. She did home deliveries. This is pre-DoorDash, y'all. Um, and she would do that because she was like, oh, this person is sick. And so at the end of the day, she'd just take them a meal. Um, and what was clear to me is that my grandmother really was in the business of just being good to people. And she was never turning anybody away for a meal. If they didn't have enough, she would just take what they had and tell them to enjoy. And she would sit down with folks and ask them how they're doing. So coming from that kind of a family and that kind of love, I've felt pretty affirmed my whole life. And I recognize that that is a privilege, deeply supported. And my family's always happy to see me. I'm also the baby, so I'm very, very spoiled. Um, and when I sit across from people, that's a part of the energy that they receive with me as their therapist. I want to offer that up because some of what you shared and some of who you are, you can access. And you can access and have people see you and see parts of you that are authentic. I also want to invite us into thinking about what it means to be home. And I think some of what I take away from decolonizing therapy in particular is that it is about a return home to wisdoms that are true to our families and our ancestors. And I want to invite this as maybe something that you could do in your free time, or maybe even something that you can use as an intervention with some of the folks that you work with. But this would be an example of helping people to bring in who they are into the room. So you can think about how asking folks and asking them to sit with how they define home. And I know for many folks, home isn't necessarily a good place, but so inviting folks to think about what a safe home would feel like, and thinking about who you feel most safely at home with and around. What are maybe some of the emotions that you associate with being home, safely at home again? And what does home feel like in your body? And again, as an intervention, this can be a different kind of way to help people unpack and come into relationship with their emotions. Because I think with all of the conflict and harm that we encounter, and what's clear to me when I think about our socio-political climate is that so many of us really just don't know how to be with ourselves, and we run away from ourselves, and we, it kind of distances us from other people. And so inviting folks to unpack and explore who they are in different kinds of ways can be really helpful. So I'm going to close this out by just sharing some more nuggets and wisdom that I think will be helpful as we move toward the future of care. I'd like to just generally call us to more collective ways of being with one another. Some of the most painful times in my life have been times where I have felt pretty isolated. And I didn't realize it at the time, but it's when I look back that it was really, isolation that was a big part of that. And so, being with one another, being closer to one another, creating more room and space for the folks who are in our lives, both personally and professionally, feels really important. One of my favorites, and a person who I deeply admire and follow, is Prentice Hemphill. I have a serious crush on them, but they think about embodiment, and they have a book, What It Takes to Heal, that'll be on one of the last slides. And they talk about this notion of things falling apart, and thinking about conflict in particular as something that we really need. And that is particularly the good stuff in conflict is happens when we're able to take risks and be vulnerable with one another. And that conflict really, what we can do is explore what is trying to be known. I think that a lot of conflict can be thought of in that way when we kind of get down to the bottom of it. Something's attempting to be known, and we can reshape how we think about conflict as a way to kind of normalize things and also calm our nervous systems. And this is a direct quote: "We can fall apart and come back together all of the time if at our core we believe in our development, that we grow, deepen, and mature." Also, I think just this notion of allyship and being able to expand who we consider in our we feels really important. And that certainly feels really important in the socio-political climate. And I think we need to be thinking more about that. We as in including all of us for who we really are, right? And folks not having to mask as much. And rethinking and thinking about allyship and being an accomplice with folks is being about having the backs of people who can lead us into places that we haven't gone. Some of the very people that we've been trained to be glad that we're not. And a direct quote, "We're already kin, whether we like it or not. So how can we live as though our living depends on one another?" This is some of how I've started to think about just growth and my own healing and liberation. Again, conflict is being about just some of the ebb and flow, and vulnerability as some of the good stuff, but it can, if we let it, offer a watering and a nurturing in our relationships. And thinking about those ebbs and flows and the seasons of our lives is temporary and meaningful to the overall picture of who we are. And truly celebrating difference as a way to kind of nurture our environments and the work that we do. So obviously there is not certainly enough time and space to unpack all of the constructs that I talked about. And so I hope that you will take a deeper dive into some resources. And again, this will be, you'll have access to this, but I referenced What It Takes to Heal, Decolonizing Therapy, the safety, belonging, and dignity. And that construct comes from the politics of trauma. And The Body Is Not an Apology is a really great resource to be thinking about disability justice and how we can be with our bodies more. And then We Will Not Cancel Us is an essay from Adrienne Maree Brown that talks a little bit more about the difficulty and the challenges of humaning, and some other resources as well. And then some platforms that I follow. And one of the things that I think is in the future of our care is really collaborating with other folks. Most of the learning that I've done and some of what's been most helpful to me is less about what I learned in my program. And I've kind of given myself my own education through learning from other fields and other disciplines and seeing what other folks are doing. And so I think it's really important for us to expand our lens and know that there are other folks who are doing this work, and that we can bring in some of those resources and tools into what we do and who we serve. That is it.